City of Pittsburgh, and we'll just cover what we have to offer if you choose UPMC Health Plan. And let me just get the slideshow pulled up, and we'll get started. I'm going to be unable to see any questions, so Charisse, if something comes up that if you want to answer questions at the end or if you want to stop me during, either one's fine.
Okay, I'll let you know.
All righty. So some things we'll cover today. We'll cover your plan, your benefits, pharmacy coverage, how you can get options for care, digital and online tools that you have at your disposal if you choose UPMC, how to find a provider, and I'll give you our customer support information. So why choose UPMC Health Plan? Well, as Pittsburgh residents and living in the Pittsburgh area, you'll see our hospitals are purple UPMC everywhere. You choose UPMC, you're choosing in-network access to UPMC, among other thousands of doctors and community hospitals and facilities where you live and work. We're constantly innovating and investing in the Pittsburgh area. As you could see, the UPMC Mercy Pavilion, that's on the Boulevard of the Allies. That's a vision and rehab center. That's a hub where our clinicians will work to come out. What is going on with this slideshow? I'm sorry. There we go. All right, maybe this will not want to just run with it. But the UPMC Mercy Pavilion focuses on vision and rehab services, where we're trying to get people back to their best self, restore vision, cure blindness. If you go down Fifth Avenue, you'll see how crazy it is that we're building the Presby Tower. You'll see all that torn up. We're going to start to build that. That's going to be a hub for transplant services, immunology, cancer care, just a massive investment in our members' health and the city of Pittsburgh itself. So when you choose UPMC, we are constantly innovating, partnering with the University of Pittsburgh School of Health Sciences to work on all types of cures, all types of care to get you back to your healthiest self faster and healthier than ever. And when you choose UPMC, you're choosing award-winning customer service with UPMC Health Plan. We've won numerous industry awards. We've won J.D. Power Awards. We're here to answer all your questions, make sure that you're taken care of and that you know what to expect before you get care or help resolve any issues after you received care. And of course, the UPMC hospital system has won numerous clinical awards as well for patient care, quality of service, cleanliness, you name it, we've won it. We're here to help you and make you as healthy and happy as possible. So we'll talk about some things that come with every plan. And when you choose UPMC, these are complimentary services that come at no additional cost. And chief among those is preventive services. We believe the best condition to treat or disease is the one that you never get. So that's why we cover adult and child preventive services at 100%. And these outline just some of those offerings. As you can see, there's screenings for cholesterol, blood pressure, mammograms, your annual physical, obviously. If you're over 50, colorectal cancer screenings, and of course, immunizations, the recommended Tdap, tetanus, diphtheria, pertussis, the annual flu shot, the COVID booster, if you are applicable for that. And of course, BMI measurements, your annual physicals for your children as well. We also partner with Active and Fit Direct to offer gym access. There's more than 12,200 fitness centers that are in network with Active and Fit Direct. There's an on-demand fitness video category as well, where you can choose over 9,300 videos. That is an enrollment fee that's $28 per month and some applicable taxes. And then depending on what gym you choose, there might be some more charges just for access to like national options. We also have a health coaching program where you are able to meet with one of our clinical specialists. They're registered dietitians, nurses, certified diabetic counselors, social workers, they can just help create a plan to help prioritize what you want to do with your health. If you have a goal for fitness, if you want to stop smoking, if you want to get more active, they're here to give you all the resources and support that you need. They work around times that are convenient for you. And again, it's at no cost. You can call them, contact them with the member information that you'll get when you enroll. And this just covers some of the programs, like I said, losing weight, eating better, reducing stress, tobacco cessation, getting more fit and active. And then there is, in addition to those lifestyle ones, there is condition management. They'll help with anything covering heart disease, diabetes. If you're an asthmatic or if you have other chronic conditions, they can assist with that. And there is emotional health and behavioral health coaching support as well to deal with depression and things like that, stress, anxiety, everything that we all experience. Baby Steps is the UPMC Health Plan's maternity program. You get connected with a maternity health coach. They give you support, answer your questions, help you along your journey there to delivery. This again is no cost to you. Baby Steps health coaches are registered nurses who have experience with obstetrics. This PowerPoint is just not cooperating with me today. Let's see what I'm doing. Okay, we'll just have to keep bouncing back, I guess. I don't know what's going on, but they can answer questions. Yes.
Sorry, this is Dana. You know what? If you go into settings, it might be on slideshow, and it automatically moves the slides for you.
What should I do to change that?
Hold on, I'm looking. I'm sorry.
No, you're good. I practiced this yesterday, and I promise this didn't happen all.
Unclick use timings. I think that's it. To the right. Yeah. That
Perfect.
should let you move the slides yourself.
Thank you, Dana.
Sure.
Dana is the account executive for the city of Pittsburgh as well, so I assist her with any questions and issues that come along with the group. But Baby Steps, the registered nurses have experience with obstetrics. They're here to help coordinate your care between all the physicians that you see. If you have your PCP specialists, they're here to make sure that your care with your baby is at the utmost and at the forefront of everything that is going on with all of their plans for your care. They help find prenatal exercise and parenting classes. And you can talk with these maternity health coaches just like with the regular health coaches at times that are convenient for you. They offer face-to-face via the Anywhere Care virtual app that we'll talk about a little bit later, and telehealth visits, a phone call, whatever is convenient and whatever you'd like. And as a member, you will always have coverage to deliver in a traditional hospital setting or at a birthing center as well. Whatever your plan is for your delivery, that maternity health coach will be there to assist you. Behavioral health care is always at the forefront of what we're thinking and trying to help provide and resolve. We take great pride in our behavioral health coverage and benefits. We help to get you connected to a professional that will help resolve and get you the help that you need. That phone number is available at no cost to you to help connect you to a behavioral health case manager. And this is just some of the treatment options that they can provide for emotional difficulties, if you're going through a bereavement or a loss, if you're having marital or family problems, if you were diagnosed or are trying to get treatment for your mental health. They can help with some disorders, and if you have any questions on substance use or dependence for anyone on your plan, they are there to help and get you connected to the appropriate resources if they are unable to assist, telephonically or via telehealth. We'll cover some of your benefits, and we'll just break down some basic terms that will hopefully make understanding your plan a little easier. So your deductible is the amount that you must pay for covered health services before your health insurance plan will begin to pay. That's for things like labs, imaging, hospitalizations, those big ticket items. Once you meet your deductible, then the insurance will start to pay. And under certain plans, there's co-insurance. And that's basically the cost sharing arrangement and the percentage that you would pay for those services that apply deductible. And the insurance UPMC health plan will pay the other portion. There's also co-payments with your plans. These are typically more for office visits. Think PCP, your specialists. If you have physical therapy or occupational therapy, it's just a fixed fee that you'll pay for a covered health service, and it's usually paid at the time of service. And cost share generally is just the amount of healthcare cost that you would be expected to pay out of pocket. So when you choose UPMC health plan, you're also choosing your pharmacy benefits, and you have access to both regional chains, national chains, and local independent pharmacies. And this listing here showing Giant Eagle, Target, Wegmans, Sam's Club, CVS is just a small portion of all of the pharmacy providers that you'll be able to utilize both in the region, or if you're on vacation and need that emergency script for something, you'll be able to get them filled there as well. And if you have any dependents that are living out of the area, going to school across the state line, out west, north, south, wherever, they'll be able to get their scripts filled as well. And we partner with Express Scripts as well for home delivery. So if you have maintenance medications that you take for things like asthma, high cholesterol, blood pressure, diabetes, you can get those scripts transferred to Express Scripts via that email, or I'm sorry, via that URL, express-scripts.com/lower cost. And that phone number, 1-877-787-6279. There's usually a lower cost associated when you choose a 3-month supply. So just check your benefit grid for certain. It's usually 2-month copay for a 3-month supply. And you can sign up for automatic refills when you have just a month remaining. It's just a convenient option to have when you know you're going to take that medication every day and save one trip to the pharmacy. If you are new to UPMC or you would like to have one of our pharmacists review your medications, you can do that as well. Our clinical pharmacist can help identify and resolve any kind of potential issues before you go to the pharmacy, things like a prior authorization, if there's step therapy, and they can help make those pharmacy visits fast, efficient, and simple. You can just go to upmchealthplan.com/pharmacy review. Just put in some information, and then they'll connect you to one of our clinical pharmacists that'll reach out and help resolve any kind of issues or questions you have about your medications as well. Next, we'll talk about some options for care. So as I stated earlier, you always have access in network to any UPMC doctor or facility among our other affiliated and participating providers. But when you're outside of our regular servicing area in Pennsylvania, you'll have access to our national extended network. And we partner with the Cigna PPO network, and they would be considered in network. That's more than 1 million healthcare providers and 6,100 hospitals throughout the United States. So that would be places like New York, California, Texas, Florida, that you would have that access to those providers. If you're in Ohio, though, there is access to the SuperMed PPO network, which is another comprehensive, expansive network. There would be complete coverage for any dependents that are going to school in Ohio or throughout the United States as well. And speaking of those dependents and those college-age children, they have in-network care on their at their on-campus student health center as well. The UPMC Anywhere Care is a great virtual tool. It provides access for treatment for a lot of non-emergent conditions. You can see here cold, flu, sinus, COVID, bronchitis, pink eye. You just answer a few questions, and then you'll have a virtual visit with a provider over live video. And if you need a script, that provider can send it to your pharmacy. They're there 24/7. So no matter the time of day, if you're not feeling well, you can just download that app from the Apple App Store or the Google Play Store, and they'll be able to help assist you. It's usually at a lower cost as well, rather than going to the PCP. And it's an awesome resource when you're not really feeling well and you don't want to make that trip to the doctor's office. And it also can be used for newborns up to 17-year-olds. Any children that you have under your plan will be seen by a Children's Hospital of Pittsburgh provider, and all those same conditions and all those same things apply with getting a script, if necessary, sent to your pharmacy. Another complimentary service that you get when you choose UPMC is the UPMC My Health 24/7 nurse line. That phone number is staffed with registered nurses that are here to answer your general health questions, or if you need to triage your care, if you're not really sure you should go to an urgent care, an emergency room, maybe it's something that could wait a day to see a PCP or a specialist. Um, they're there at no cost to you to tell you how to best take care of yourself and how to seek a higher level of care or whether it's appropriate. Again, they're there 24/7, and this is at no additional cost to you. It's just a great perk of choosing UPMC Health Plan. Another one of those is the global travel assistance that we offer through our partnership with Assist America. If you or one of your dependents is ever experiencing an emergency more than 100 miles from home, and they're away for less than 90 days, think like a vacation, overseas travel, Assist America is great to help connect you to doctors or hospitals, get a script sent to your pharmacy. Among the more things that we hope that never has to happen, like a repatriation, where you have to get sent back home, and they will help organize flight and travel. They can help get you into a foreign hospital if need be. That their app is in the Apple App Store and the Google Play Store. And you can contact them 24/7 to access that emergency operations center. One of those things we hope you never have to use, but if you have UPMC and you have to, it's there for you. Next, we'll talk about some digital and online tools that you have. And among those is the UPMC Health Plan mobile app. This is a free download, again, from both the Apple App Store and the Google Play Store. You can access your digital ID cards. You can chat with one of our healthcare concierge or a health coach through the app. You can look at your explanation of benefits. You can view your claims, where you stand with your deductible or out-of-pocket spending. You can check to see what providers are in network. You can see how close they are and where they're located. You can view your recent claims, and you can complete the My Health questionnaire, which is just a health risk assessment. They measure your overall health after you answer some questions. They give you a score and say, hey, maybe you should work on these things to optimize your health, or you're doing really good with these things, keep it going. There's a lot of great resources. And again, it's free to download and will contain all your insurance information that you might possibly want to check for yourself. I'll talk about the My Health Online first. That's just the web address that you can access all your information on. Just like I said, that's just the UPMC Health Plan app in a desktop form. So you can print ID cards, you can check your spending, you can check your claims, your explanation of benefits. If your plan offers a flexible spending account through UPMC, that information's there as well. You can view your previous UPMC coverage if you have had us, and you can explore treatment options and use a medical cost estimator to get an idea of what you might be expected to pay for specific services before you go and get those done. And if you have UPMC or you use UPMC providers, the My UPMC app is, again, a free download. It contains all the clinical information that you might want to access. You can view your past medical records, test results. It'll give you a breakdown of how to interpret those as well. You can schedule appointments with UPMC providers you've seen in the past. You can pay your bills, or you can send a prescription request as well if you're out and there's no refills left. You can just send a message to your doctor's office and they'll take care of it from there. and I use it very often. They're very responsive, and I'm sure my doctor's office appreciates me making one less phone call to them. The RX Well app is our behavioral health app that focuses on cognitive behavioral therapy techniques to help you manage your physical and mental health. It is, again, a free download, and our members have access to that in-app coach support. This is just some of the topics that they could assist with: stress, anxiety, depression, getting more or better sleep, tobacco cessation, weight management, increasing physical activity, nutrition, and some diabetic counseling as well. There is the decision support tool that is available through that My Health Online desktop version of the UPMC Health Plan app. That helps estimate the cost for a medical procedure. If there's any variance between like going to UPMC Presby, UPMC Mercy, or if you wanted to use one of the other participating hospitals like St. Clair, that'll tell you if there's a cost difference between getting that procedure done at any of those. It can help you decide if that surgery is right, how you can save money, and helps give you some prep on those procedures as well if it's available. Things how to get ready or what to expect. All right, and now we'll cover how to find a provider with your UPMC coverage. The best place to go is upmchealthplan.com. And if you follow these steps where you just select find care, if you're a member, you can put in your ID. If not, you can select that you're just browsing. You can select medical, behavioral health, and even pharmacies, or if you have dental vision through UPMC, you could use that as well to find those types of providers. You just select how you get your health insurance. In this case, that would be through your employer. And you can choose the appropriate button based on what you want to search. You can search by a provider's name if you're looking for somebody specific. You can search by a specialty or type of provider, like an urgent care, outpatient, ambulatory surgical center. You can search by the type of procedure or the service, or even some medical equipment as well. If you type a last name, a practice name, a specialty, you can put that in the search term field in the buttons below. And then you want to select, obviously, how far you're willing to travel or where this provider is located. So you can use county, address, city, zip, and then hit search. It'll pull up a digital map that you'll see here in just the next slide, but lets you know the address, the phone number, the hours, the language that the provider speaks. If you're looking for somebody that, if you speak English as a second language, if they speak your native language, all that information is available there. And this is kind of just a rundown, a quick snapshot of what, if you look for OBGYNs, what that map would look like. It's nice. It gives you the layout of the land, the roads, some key landmarks, so that you know you're going to get to the right place. And again, the address, the phone number is listed there. And if you click onto like that, Dr. Brian Cohen, it'll give you just a little bit more information, like that language information as well, and their hours. If you're not a UPMC Health Plan member currently, and you are looking to transition to UPMC, and you're currently seeing your provider that you know is going to be out of network or not participating with the plan, you can fill out a transition of care request form. Some clinical notes will be required as well, but this allows you to have a final wrap-up visit with that provider to make sure that there's no gap in your care and that you're going to get the appropriate treatment that you need before you transition to an in-network physician that would be at a lower cost for you. We would like to have these within the first 30 days of enrollment to make sure that there's no gap, that you're getting that consistent care. So if you know that you're going to transition or you're thinking about that, you can contact our member services team. We'll show their number in a few minutes, or you can visit the upmchealthplan.com website to get that form and start ahead of your open enrollment. And typically, like I said, 30 days to get that wrap-up care, but it can be up to 90 days and longer if you are pregnant and wrapping up that care leading up to your delivery. And finally, UPMC Health Plan is here. Our call center is staffed with excellent healthcare concierge that are here to answer any questions that you have regarding your plan and your coverage. They're here Monday through Friday, 7 a.m. to 7 p.m. and Saturdays, 8 a.m. to 3 p.m. Eastern Standard Time. And you just call that phone number for your dedicated representative, 1-844-780-7044. And our JD Powers award-winning team will be here to answer any questions that you have. Thank you so much for taking some time out this Friday morning to listen to our offering, and we hope that you choose UPMC Health Plan. And if you have, we're happy to have you and keep providing great care for you.
Thank you, Brandon. I appreciate your time. And thank you
Oh,
everyone for participating. I'm going to stop the recording now, and then I'm also going to end the meeting. So unless anyone has any questions.